All right, so let me just start by explaining who I am and what we do here. So I'm the manager of Healthy Places at South Western Sydney Local Health District. And the Healthy Places unit here is a little bit different to Healthy Places units in other local health districts because we have these partnerships with local government. We've got 5 of them. I'll talk about them later, but that's our sort of point of difference. And I'm pretty new to the job. I've been in it for about 3 months now. But before that, I was in one of those partnership roles that we co-fund with local government for about 5 years. So I was the Senior Strategic Health Planner at Wallumbilla Council. What does health have to do with planning and placemaking? This is something that probably a lot of you on this call are going to already know about, but lots of people don't. So yeah, it's one that is often a shock to people when you try to explain what it is that we do. I like to go back to the earliest planning code that we have, which was the Code of Hammurabi, which is I think about 6,000 years old, maybe 6,500 years old. And that includes planning law. I mean, it's the first laws that we have, but it includes planning law. And there's a law that says if you build a house and that falls down and kills somebody, then you should be put to death. So basically, from the start, planning has been at least partially about health outcomes. We hopefully use it as less of a blunt instrument than it was used back in those days. But yeah, so there are various determinants of health that are able to be manipulated by and impacted by the built environment and by the way we do design, the way we do place planning, and the way we do placemaking. And that ranges. Transport is one of the big ones, how we get around, what we have access to. There's also access to work, access to education, access to all of the opportunities that we have, healthy food, access to health services. I tend not to emphasize that one because it's the first thing that people think of when you start talking about healthy built environments, but it is definitely still a factor. There are also environmental determinants, and some of them are dealt with in a very comprehensive way by our existing planning systems, and some of them are kind of ignored because they're often intangible and difficult to tackle. Social connectedness is one of the big results of things that we do as well. So again, it's fairly difficult to measure and difficult to measure the inputs on, but it is a huge area of impact for the way we build and design our cities, towns, places. So why are we tackling this via partnerships? In the health sector is what's called a health in all policies approach. We're looking at how we can make health interventions via other areas of government, other areas of social policy. So it's about embedding health thinking into other areas. And it's particularly massive impacts that can be achieved via various sectors, and the planning and built environment sector is one of the bigger ones. So the reason we take a partnership approach is that it allows us to connect people who have the evidence and people who know about health impacts and about how they are constructed with the people who can actually make change on the ground. So in particular, we're doing partnerships between us, health, so we've got health expertise on our side, and local government, which is responsible for a lot of the built environment outcomes that happen. It'd be good to also have partnerships with things like Transport for New South Wales and planning even, but that's one of those watch this space things. It's a little bit more difficult to achieve. So also there are new initiatives going on, particularly in southwestern Sydney. It's a huge growth area. There's a lot going on. And so that allows us to have, particular impacts. There are things changing, and whenever there's change, you can jump onto that and achieve some things. The other advantage of the partnership thing is that we just have two-way capacity building. So we're helping our local government partners to better understand the health impacts of the decisions that they're making, but they're also building our capacity on how local government works, how planning works, how design works. So there's a lot of give and take. So we've got 5 of these. They've been all running for different lengths of time and have a different approach. The Fairfield one has been running for about 30 years now. Wallumbilla one's been going about 5 years. Campbelltown, 5 years, but it's gone through a couple of changes in that time. Liverpool, about 4 years, I think. Canterbury Bankstown is very, very new, and the MOU was just signed, I think, in July. So, but the Fairfield one is more of a health promotion thing. It involves an officer who is embedded in their community area. Wallumbilla and Canterbury Bankstown are both sort of planning based, and Campbelltown and Liverpool are both design based. All of them, though, have pretty much the same fundamental goal, which is about influencing and shifting systems. So we're trying to get council decision making to really, really consider health at a deep level. And it's basically the same approach as well for all of them. We're co-funding this officer, and that officer sits most of the time in council, but also sometimes with health. And that officer drives the various agreed outcomes and projects and really tries to, again, embed the thinking that we want them to embed in both organisations. And it's just a photo of what was the old team with 2 of the Healthy Places people from health on the right, and then 3 of our partnership officers. We're still recruiting some people at the moment, so we don't have a team that large at the moment. We're working on it. So this rather awkward diagram is a demonstration of how one of the partnerships works. They've all got something fairly similar to this in terms of the structure. There's usually a partnership steering group. There's an MOU that obviously governs all of it, and a set governance framework, usually terms of reference as well. But as you can see, you've got this joint officer who has reporting lines to both organisations, and those reporting lines involve being embedded in a particular team, and so those teams have their own tendrils within their organisations, and they reach out into various other bits. One of the former partnership officers used to talk about weaseling into things, and that's a really useful quality in one of these partnership officers. There's also usually working groups that they're a part of and various health alliances and things. And I'll just briefly give a shout out to Chetra, which is the strange blob that I've got there, which is the Centre for Health Equity Training, Research and Evaluation. It's another partnership itself and sort of a research institute. And they're experts on HIA, amongst other things, and give us, that's health impact assessment, for those who don't know. They're a really great source of expertise for feeding into the various projects that we're doing. So some of the things that we've got done in the last probably 6 years that the partnerships program has been running, we've done various bits of policy and legislative change as well as cultural change, and those things lead into design change. But yeah, so creating one of the big jewels in the crown is the Wallendelli Social and Health Impact Assessment Framework, which allows council to review development proposals, so development applications, planning proposals, things like that, even environmental impact statements, various other documents with a health lens, looking at what impact those developments are going to have on people's health and what we can do to those developments to change them. And so that's a thing that happens live. There's a working group that works on it, and it's not something that any other council has. Some of them have an SIA, so social impact assessment program, but it's usually much less far-reaching and tends to end up being just about liquor licenses. So that's one of the really sort of successful bits of the partnership. Various health and wellbeing strategies for new growth areas. There's also been content in local environmental plans, usually objectives there, as well as content for local strategic planning statements. So that's the policy end of things, and you need to get that in place in order to start making day-to-day decisions better reflect health outcomes. And then the cultural change aspect, I'm going slightly backwards here, is just that there are more of these discussions happening at all levels. And then all of those things lead to more design change. And so some of those changes have been Healthy Streets pilot projects. For those who don't know the Healthy Streets approach, just Google or type into your browser healthystreets.com and you'll get a good sense of what's going on with that. It's a really, really great approach that Southwestern Sydney has really championed over the last few years. Before my time, I'm really glad that my predecessors worked so hard on that. Street design specifications for various councils have been changed, and they've particularly been changed to incorporate some of those healthy streets principles. And in particular, also Campbelltown, they're working on a blue-green grid at the moment that is a lot of really deep design work with our joint officer, Dave Chernikovsky, who has done some pretty amazing work getting that up and running. So what we've generally found is that to make these things work, and Chetra has done an evaluation on this as well. They've done a full research project on these various MOUs and what makes them work and what are the barriers. But the real keys are that you've got this embedded officer in there, because if you don't have somebody in place whose job it is to drive change, then change doesn't happen. You just end up with business as usual. Despite everyone having the best will in the world, no one has time to incorporate things into their daily work life unless there's somebody else pushing them to do it. The next key is just having those 2 reporting lines. I mentioned this earlier with the structure diagram. Having this deep buy-in from both sides of the fence really makes a difference. And then having these partnership steering groups to actually guide the content. Usually each one is structured a little bit differently, but they've got usually a couple of reps from either organisation as well as the joint officer. So that's a chance to have regular meetings where you're discussing the progress of it, because the partnership officers can get a little bit isolated at times because they're the only person in their organisation actually doing that work. Whereas everybody else in council is sort of part of a team that's all kind of swapping work around and doing things in multiple fields. So it's really good to have those catch-ups for the partnership steering groups. And it also keeps you on track. So you can figure out which things to prioritize at any given moment, because one of the challenges as well is that because this partnership stuff is not done in most places, it's very difficult to figure out what your workload is going to be in advance, because all the projects that you're working on are unique. So it means that you need to be a bit agile about how you arrange your work program. So again, having that steering group to monitor that and guide it is invaluable. And then just taking up any broader capacity of building opportunities that come up. So there are heaps of opportunities that arise as you go with new developments on the horizon, or new initiatives. Council will get a grant for something, or the health district will get a grant for something. And so being able to take those opportunities and go, okay, well, this thing is an opportunity to reach out to this sector or this silo that we haven't yet had contact with, and evangelize what we're trying to do with them. Those are also invaluable. And so again, it's just a matter of being able to jump on those opportunities. Yeah, I had a questions slide, but yes.
You killed it. I've got a question. Do you know of any other setup like this in Australia, Chris, where you've got like a state government working with local councils to embed a health practitioner in there?
Not aware of it happening anywhere in Australia. The UK does it. They have a program with the NHS and local councils.
Yeah.
Their structure is a little bit easier to do it with because public health units are embedded in local councils, so they're already doing some of this. Local councils there are much larger, do a lot more than they do here. So I'm not aware of any others in Australia, but if anyone else is, then I'd really like to hear about it.
Yeah, I mean, even just from an ACT perspective, the health directorate is kept quite separate from the planning and design directorates. There's very little crossover, even though it's all under the one government umbrella here, I think.
Yeah.
Yes, Encia, please.
Hey, yes, thanks for a great presentation. Just have a question. What were the surprising achievements that you have seen so far embedding the health officer in that structure? And what challenges are you facing at the moment?
Sorry, that first one was surprising achievements, was it?
Yes.
I think, so having now been on both sides of it, the thing I've probably been most, impressed by is the way my predecessor or predecessors were able to use the partnership officers for capacity building on our side of the fence, so on the health side. So we knew that it was about targeting councils and trying to make them change the way they do things. But there was a particular document that I now get to take credit for, even though very little of it was actually my work, called the Healthy Urban Planning and Placemaking Position Statement for South Western Sydney. And that is a document that allows us to, so partly it allows us to make submissions much more consistently, and it also allows us to really explain our expectations to developers in particular and other people in the sector, so other government agencies as well. And so that statement contains metrics for what good design, good planning looks like, in a way that previous documents that are available in New South Wales at least haven't. And it's I think a really, really hugely effective document. We've only just started using it, but when my predecessor, who was my manager on the health side, Jenny Pry, came up with the idea for this thing, I thought it was a terrific idea, but she would never ever get it up. And I thought it would never get any kind of engagement from councils and would never be approved by a local health district. But lo and behold, she managed to get it through, and another person in our team, Alison Dunshay, did a huge amount of the work leading that one, and actually creating the metrics, pulling those together from various other tools and documents and so on. So in New South Wales, we already had this thing, the Healthy Built Environment Checklist, but for practitioners in the built environment, that was almost impossible to use because it didn't have hard metrics. And so pulling together something that does means that suddenly all of these council officers are empowered to incorporate these targets. The reason why I'm touting this as an advantage of the partnership program is that what really enabled it to get as fully realized as it was the input that we got from local councils via the partnerships. So being able to have that level of contact meant that the planning teams in those councils were able to have a lot of input into this document and able to tell us what was going to work for them. What was it that we could give them that would help them to do what we want them to do.
Chris, are you able to share some of those links in the chat just to the Healthy Streets Chetra, was it? And then that document you've just referenced, because I think I know quite a few people on this call who have been through the Healthy Streets training, but those other ones I haven't personally heard of before. So they might be interested. That'd be awesome. Thank you very much, Chris. In the interest of time,